Welcome everyone to Beauty and the Surgeon podcast. I'm Amy, I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
Doing pretty good. We're getting through the COVID crisis. I have not shaved. I need a haircut.
You got the Hemsworth.
Yeah,
I got the hair slicked back.
I got a lot of stuff going on here. But I think across the country we've at least hit the peaks in some of the major areas. So I think we're getting into a better part of this COVID crisis.
But that's not what we're here to talk about today.
No, we're not. So we're trying to get people's minds off of all the stuff they're dealing with. And we actually have a fun episode planned. So Amy, tell us what we're going to do.
We do. So we're going to be answering some of your questions. We have about 5 questions today. And if you listen to our last podcast about social distancing, we still have the same slide because we're still social distancing. As you can tell by the quality of this video and the audio, Nils, our producer, is not here. So.
Oh yeah, by the way, Nils is not here. So do not hold anything against Nils or Magnuson Media in regards to the quality of what you're hearing right now.
That's all me.
The next podcast will be legit.
So we're hoping to be back to regular recording with Nils next month in May.
We're doing some pirate podcasting right now.
Yes, we are.
Okay.
We're underground podcasting. But we promised to answer questions in the last podcast. And as is typical for us, we talk too much and ran out of time.
That's true.
So we have the questions now.
This is like part 2, but we're going to do the questions.
We are. So we're just doing the questions today. So it's going to be really fun. We're going to answer your questions. These were submitted via Instagram. So if you don't follow us on Instagram, definitely follow us at Beauty and the Surgeon podcast and also at Jason Martin MD, because we do sometimes ask for your questions. So if you have a burning question to ask a plastic surgeon or nutritional therapy practitioner, this is how you ask us. So
right.
Yeah.
You have access to us.
Yes.
We're
very
VIP.
Accessible.
Yeah, exactly.
Yes. So we have a pretty fair amount of questions for about plastic surgery and then also some about nutrition. So we'll kind of just go back and forth.
Good.
And
Perfect.
Dr. Martin knows what one of the questions is because he answered it. It's the one that we both answered. But the other ones you don't know.
Oh, that's good.
So,
I like this.
Yeah. So.
You're like you're getting inside baseball stuff that I don't really read the questions.
Well, these were submitted. I
got you.
Requisitioned these. So yeah.
Amy reads the questions. Thank you.
Okay. So the first question, I'm not going to say the username just because I don't know if people will be okay with that. But this woman asked, what is the most successful autologous facial fat grafting technique and filtering process?
That's pretty good.
It's a good question.
Yeah. So autologous, that means from your body. Fat grafting means taking fat from someplace in your body and putting it somewhere else. Yeah. So it's
like the dream. It's like the great white. Like everybody wants that.
Everybody wants
fat somewhere, put it someplace
wants to
else.
like mold fat into other areas of their body. So the common area that we do that is on the face and neck. And why do we do that? Because it's a great alternative to dermal fillers. So fillers like Juvederm and there's so many.
Radius, Sculptra, there's so many.
Voluma, all these different types. This is a great alternative. Why is it a great alternative? Because it lasts pretty much permanently. So fat grafting is a great option for aesthetics. One of the other places we actually do it is in the breast after breast reconstruction. I do fat grafting a lot. I have tried all different types of techniques to isolate the fat and re-inject it.
Yeah, and that was her question about filtering. So maybe talk a little bit about why we filter fat or how we treat fat when we extract it, because that is really kind of a key differentiator between whether or not that fat lives or dies.
Right. So historically with fat grafting, we suck the fat out. Just like liposuction, we usually do it with a syringe and a small cannula. And the way I was trained a long time ago is that you would spin it around in a centrifuge. And you've seen that in like movies or labs where it spins around really fast, like a merry-go-round that's going like 100 million miles an hour. And what that does is spin out the fat and gets rid of all the other stuff. When you harvest fat, you usually put some solution in there called tumescent solution or tumescent anesthesia. And when you aspirate the fat, when you suck the fat out, you get components in that fluid like blood and other elements you don't want to re-inject.
Yeah, because we put certain types of drugs in that fluid as well to stop bleeding and also to help with pain management.
Right.
And there is some theory that like the epinephrine in there could potentially
affect the way the fat
goes. So
right.
there's so many theories around how you should treat the fat when you're taking it out.
Right. So to break it down, you suck the fat out. Everybody gets that. And then you wash the fat or isolate the fat, or you only want the fat. You don't want all the other stuff, and then you re-inject it, right? The way grafts work is when you re-inject it, it uses your own body's blood supply. And by a process which includes words like imbibition and all these medical words, the graft takes and the fat lives in that area. It's pretty cool.
It is. And I mean, even with the best care taken with fat transfer, not all the fat cells live. because they're either damaged during the process or they just don't get enough blood supply in the new area. So your body's really smart, but it also is really smart. So it's really smart in helping new cells live there, but it's also pretty smart in being like, no, this is not the number of fat cells that are here.
Or no, this is not going to work.
Right. We don't
I'm
have
sorry.
no nutrients for this.
I turned my back on you. No fat.
Yeah.
And different areas of the body take fat grafting better than others. The face is very vascular. That's why the face is less likely to have problems like infections, not related to deep tissue infections like with teeth and bones and stuff like that. So, fat grafting is a great option. We use it all the time in the clinic. We use it with face and neck lifts. And a lot of people want fat grafting because they do not want to keep going back every 6 months for fillers.
Yep.
And
that's expensive.
It's very expensive.
Really expensive.
If you dollar cost average by doing fat grafting in our office or an office like ours versus dermal fillers, the fat grafting is always the best option.
Yeah, but there are issues with fat grafting,
which I was going to get to.
Yeah. So
the first thing is, okay, this is when we get real talk. People go to offices and are like, oh, fat grafting is great. It's the best thing you could ever do. Nah. At best case scenario, about 60% of it takes. And we'll get to the question, which is a really, really good question. So thank you, whoever you are, anonymous person, for the question. That only, best case scenario is 60% of it takes. So if you do fat grafting in your face, then best case scenario, about half is going to make it.
Yeah, which also is why a lot of offices will overfill with fat essentially on the first go around.
Which could be a problem too.
It can. Well, you can look really weird, and unfortunately, you can't judge where that 60% is going to be. So you might have an area where the take of that fat is closer to, let's say, 70%, maybe an area where it's 30%, and you're bilaterally injecting. So if you have one side that took 70%, one side that took 30%,
right?
There's a little bit of tailoring that would need to be done to adjust that.
Right, totally. And it's usually not that extreme, but you're making a point, which I totally get. That's the first thing. And secondly, fat grafting, some people, it just doesn't take on some people. And if someone tells you, they know exactly why they don't. If you smoke cigarettes, if you have diabetes, if you have any inflammatory condition, if your body is hypervigilant and doesn't like anything that's weird underneath its skin, sometimes fat grafts don't take.
Right, or if you lose a lot of weight after you have your fat grafting done, like your fat cells are going to shrink just like they do everywhere else. So you could lose the effect of your fat grafting through weight loss. I mean, it doesn't mean that fat went away, but it shrinks. So as people ask, if we had a patient come in one time and say that a doctor had told her that she needed to gain something like 50 pounds before he would do her fat grafting. And I asked her, I was like, well, is that going to be a maintainable weight for you? And the answer was obviously no. I'm like, well, then you should not gain weight to do fat transfer because of this. When you lose weight, that the effect and all the effort that you put into getting this fat transfer is going to diminish with that weight loss. So you should be at a maintainable weight if you're considering fat transfer.
Yeah, I mean, I don't mind you gaining a little weight for fat transfer. 50 pounds is ludicrous.
Yeah.
That's almost malpractice.
Well, even gaining 5 pounds, I mean, you're not...
I know,
unless you can guarantee you're getting 5 pounds of straight fat in the area that we're going to be taking it from, it's such it would be such a minimal difference. Like, you really should just be at a weight that's maintainable.
So we've used every different type of apparatus to wash fat. We've done centrifuging.
Yep, pure graft.
We've done pure graft.
And the other iterations of pure graft.
Yeah, we've done the one that you spin. I'm sorry, I didn't know this question was coming. So there's all these different brands. Brands, there's filters that we've done all these different brands. Honestly, from someone who does this stuff a lot, I think pure graft is the best option. It uses almost like a dialysis process where only the fat globules of a certain size, and that's really small, get through, and that's when you know you're going to have the best take of the fat graft. It washes it the best.
It's closed also.
It's all a closed system, so it never goes out. You're never transferring it to one thing and the other. It goes into the bag, gets filtered, and then put right into an injection cannula. It never goes out into the open air.
Yeah, which is really key.
Yeah. So pure graft is my favorite. Again, there's like a million trillion different other options. Okay, so
the basket was pretty cool. That one that was actually part of the suction canister. We did that a couple of times.
Yeah.
We said the downside of that is you have to turn the suction way down.
There was one that literally, that was like one of those salad cleansers.
Yeah, the salad spinner.
Like you spin it around.
Yep. There's just gravity. There's just regular old gravity.
I think it's very funny that any of these companies are watching this are going to be so annoyed that I'm not saying their name. So sorry, no disrespect to each of these companies that do this, but I've tried them all and I like Pure Graft the best. So write that down, Pure Graft. If you're going to do this procedure and you really want to know a recommendation from a plastic surgeon that does this all the time, Pure Graft is one of the best ones.
Yeah.
Now, this doesn't get into stem cells.
Nope, that's just fat filtering. Totally different than
Fat
plasma.
washing is different than stem cells. Now, there are stem cells in fat, and how the filtering process affects those, we're not getting into that. We're not also going to get into the benefits or drawbacks of stem cells and where that's going. That's a whole other episode, and we will talk about that in the near future. I think we should.
Yeah, that's different than this.
Yeah. Okay, pure graft. And why is that important? Ultimately, when you think about fat grafting, you want to give the fat graft the best chance of surviving. And in reality, the way to do that is to make sure the fat you re-inject is pure.
Yep, and just treated really nicely too. So I think
Okay.
that's really cute. Okay, so the next question is for me. So it is Amy. What can I take to abate or slow the destructive impact of osteoarthritis in my fingers?
Oh, that's a good question.
This is a great question. So as a nutritional therapy practitioner, when you approach rheumatoid arthritis, it's an inflammatory condition. So the things I'm going to recommend are obviously things that are going to help combat systemic inflammation or inflammation across your body. Before recommending any specific supplements, we always try and get these substances or these nutritive benefits through food. A key thing for people who have any type of inflammatory disease is to make sure that you have done at least a basic elimination diet to make sure that you're not eating a food, not necessarily that you're allergic to, but that really doesn't agree with your system from an inflammation standpoint. And that could be a variety of things. So that would be my first recommendation, is just make sure that you've done your due diligence and made sure that you're not eating any foods or substances that you know inflame you. Because if you are, you can be taking every supplement known to man, but if you're continually ingesting something that's causing inflammation in your body, it's going to be really hard to stop that. It's like a fire. So you'd have a fire going throughout your whole body, and you'd be like putting an ice cube on it.
So
it's
there,
a supplement.
There's like tons of companies that do food elimination, like at-home tests and stuff like that. But
that's not what I'd recommend.
Yeah.
You're not looking for allergies with an elimination. You're really looking for how it affects you. So it's really important.
And how you feel, and then your gut health and your bowel movements and stuff like that.
Everything, just like really how it affects you. And it's a long process. Like doing an elimination properly is eliminating foods for an extended period of time, because you need to make sure that you get that food completely out of your system, give yourself enough time to know how you feel, and then slowly reintroduce it. Typically reintroduction is done on several levels. So you're going to eat the most pure form up to the most processed form of a food.
Okay.
So like, let's take soy, for example. So you'd start off with eating like organic soybeans and move your way up to things like tofu, more processed, all the way up to soy milk, and see, if any of those things affect you. But there can be,
and then potato chips, because potato chips all have soy in
they're
them.
all cooked in soy oil. Yes, so yes, like stuff like that. Avoiding
Potato chips would be the final echelon.
right. Really, for someone who has an inflammatory condition, I would highly recommend avoiding all fried food. It's very inflammatory.
I know.
Right.
They know that. The listeners know that too. They've listened to you long enough.
Well, hopefully they do. But sometimes those things are not necessarily intuitive. Getting rid of things in your diet that you really love, if they make you feel better, it's a pretty good trade-off. So on top of that, once you have done all of that, there are certain rheumatoid medications. Oh my gosh, what's the big one? The name is escaping me.
The one that is
like everybody takes.
The one that's a Plaquenil? The one that's no.
It's not methotrexate. I'll think of it.
Yeah, there's different types.
There's a main one that most patients who have rheumatoid arthritis take, and it can cause mineral deficiencies, specifically your B vitamins, C, D, and E deficiencies. So if you are taking that specific medication, and I'll remember the name at some point, I would recommend supplementing with some of those things, specifically probably B vitamins. Vitamin D is very key. Obviously, this is a disease that affects bone, so everybody probably thinks like, oh, I should be taking a calcium supplement. As we've talked about many times before, minerals are cofactors, so you can take all the calcium you want, but if you don't have
the other
D,
stuff, you're not going to absorb it.
You're not going to absorb it, and it's probably not the type of calcium that's beneficial.
Yeah,
for
I know.
You. So it's really important to make sure you're getting your cofactors.
Just Amy has me taking like crap loads of vitamin D, just for that reason. Yeah.
Yeah, it's very important. So vitamin D is something I'd absolutely recommend supplementing with for anyone who has rheumatoid arthritis. Perhaps some B, C, E vitamins as well can be very beneficial, and then fatty acids. So your fish oils are also going to be key. Those are things that help calm inflammation. So once you've addressed...
So for the fish oil, would that be omega-6 or omega-3?
Omega-3, 6s we don't really need. 6s and 9s are not as important, which is why you take it primarily 3.
These are all the questions I asked her already. So
yeah, and a blend is okay, but for the most part in our diet, we get a lot of 6 and 9s. We don't need a lot of those. You're gonna laugh. Cod liver oil.
Oh, here we go.
We're back with the cod liver oil. absolutely a critical thing I would recommend for anyone who has an
You
inflammatory
put it in a
condition.
smoothie, just a little cod liver oil
Not put
and
it
some
in your
strawberries.
smoothie.
And some strawberries.
No, do not drag out the flavor of cod liver oil. Just take it quick and move on.
Just think a shot of like I don't know, Fireball or something.
and chase it with something that tastes good.
Oh.
Chase it with the strawberries.
Don't they have it in the pill or no?
They do, but it's as with any of these substances, you want to keep it cold and fresh. Like you want it to be as close to natural as possible.
Natural bioactive stuff.
So that's what I recommend. So if you have further questions about that, and I will think of.
And apologies for us for getting the rheumatoid medication, which we've seen 1,000 times, which neither of us can remember.
Gonna drive me crazy.
Yeah,
I'll remember.
We'll remember before
at
the
some
end.
point. Yeah.
All right. What's the next question?
Yeah. So that was good. So the next one, I think we should go on to the one that we both answered. Just because it was pretty funny that we both answered it. I gotta say.
Yeah, I rarely answer these things. I must have been on there.
No, it was because it's a long story.
Okay.
Let's just say it's a long story. And I had
Long
already
story.
answered it like weeks prior.
Gotcha.
I had answered it quite some time before you answered it, but that's okay.
Are we allowed to say her name?
I'm not going to say names just because I don't know if people want their
This is also anonymous.
Yeah, I don't know if people want their names brought up on the podcast.
Yeah.
So maybe next time I'll say, like, if you want us to shout you out, tell me.
Yeah, we'll shout out listeners. Everybody likes to shout out, right?
Well, not everybody. Some people are more on the down level. While I look for this, let's ask the other question while I look for this one, because this one question was a long time ago.
Okay.
So let's go back to this question first, because I was going to do this one last just because it's a really, really good one. So this is a great question.
Yeah.
Have you ever encountered something that's really grossed you out during surgery? Yes.
I don't know.
First, though.
Not really, though. I mean, so in cosmetic surgery, rarely no, right? So in cosmetics,
we're not easily grossed out people.
No. So looking at body parts or having bad smells and stuff like that really don't bother me. I mean, I've gone through surgery training, and Amy's been with me long enough. So
I have two brothers. I grew up
I don't care if you come in, you haven't showered, and you smell terrible, and you're naked, and you have problems with your body. None of that really bothers me ever. To be honest with you, it doesn't even register in my brain. The only thing that does kind of gross me out is infections that really smell bad. Infections can have a really odorous smell. When I was in general surgery, especially in the gut, in the bowels, it was like almost like you'd have to almost leave the room. That's how bad it was. We had these oils that were like peppermint oils.
Put them on your nose.
And the nurses, when it got really bad, would put gloves on, obviously. This is pre-COVID. And just take the peppermint oil and put it right underneath your nose. And I have to tell you, it was acrid. The peppermint oil was so strong, it would make your eyes water, but it was way better than smelling decaying, disgusting tissue mixed with poop, basically, which is what we were smelling.
Yeah, feces.
In plastic surgery, you don't really experience that very often. You do have bad infections sometimes you'll see, and that could be like, just a patient of ours who's had a surgery, which is rare, but it's usually someone that is a patient, but just presents in a delayed fashion to our office, so not around the time of surgery and has an infection. And we just go ahead and take care of it because we're right there, and we can do that kind of stuff. And every now and then you get this kind of yucky pus coming out. It gets a little smelly. Sometimes that can be a problem. What about you?
Oh my gosh. So I have a very specific one.
Okay.
And to be fair, I grew up in a small mountain town. I have two brothers. I have seen some disgusting things. So there's really nothing that grosses me out. Like literally one time, Dr. Martin exploded a hematoma all over himself.
So hematoma is a pocket full of blood, and it exploded on my face.
So I was having to wipe blood off of him so that he could see.
And I didn't stop.
Nope.
And I can tell you, that's how you know you're dedicated. I didn't stop. I just kept on working. I'm like, can you wipe the blood off my face?
Literally off of it. I mean, there was so much blood. So that doesn't gross me at all.
Yeah.
The thing that got me, it's still almost hard to talk about. So we had this.
Do you have to take a deep breath?
I know, I do. This patient had a big cyst behind her ear.
Yeah.
And it was in our Aspen office, and we had the room that we were in was really cramped. So I was having to be like pushed up against the wall, and I had a mask on, which thankfully I had a mask on. Like, the life-saving thing of all of this was that I had a mask on. I'm pushed up against the wall, and I'm holding a retractor. Like her head's turned this way.
So you have sterile gloves on,
right?
Yeah.
She's facing you, and I'm holding a retractor this way. But I was really close because of how jammed in that corner I was. So I was pretty close to it, and it exploded. So the cyst, Dr. Martin punctured it with a suture.
So imagine a zit.
A really big. Well, people have seen Dr. Pimple Popper.
Oh, Dr. Pimple Popper. Yeah.
So,
imagine one of those
So like that behind her ear. And it wasn't that it was disgusting. It was that the smell, again, it was the smell. The smell was so intense. Like I literally thought I was going to throw up in my mask.
Yeah. Thank God for masks sometimes.
Oh my gosh. Like, I couldn't get away from it. Like I had to stand still and had to keep, like I was trying to like look away. And it wasn't because I was like grossed out by what I was seeing.
Ugh.
It was just the smell.
Did I react?
No, but you were way over there.
I was doing the surgery.
Yeah, but you were far away.
Oh, okay.
Like,
I was doing the surgery far away. You were stuck. Your head was right there.
I was like, literally, I was like this because I was up against the corner like this. Like I was.
I'm glad I wasn't doing that.
You were able to be, like this far away.
Yeah, I like it.
Oh, so yeah, that was bad.
Oh, that was a bad one.
I
kind of remember that. That was an Aspen.
Yeah.
Oh yeah.
That was rough.
Oh, we have so many more stories, but most of them aren't gross. So this good question, but we don't get grossed out.
Yeah.
I mean, there's so many funny stories. That would be an episode.
Right, funny stories are more of.
And a lot of times the patients are laughing with us, so it's good. We're not laughing at them.
Or we think it's funny after the fact. And not funny ever with the patient, but just the situation.
The situation, yeah.
Okay, so I found it. So this question, this was like I said,
this is also from Anonymous.
This is Anonymous. So this is a tummy tuck question, and she asks, while checking out surgeons' websites and checking out people at the pool, yes, kind of creepy, I've seen some results that are dramatically better than others, but one bad result seems to be pretty common. A lot of women will get a flat as a pancake belly, but still look square without a significantly reduced or defined waist. Why is that? Mm-hmm. Is it difficult to do both?
No.
So I almost want to read our answers because they're almost exactly.
Or you read yours and then read mine.
Okay, so my answer.
But listen, we gotta. If who's ever watching this, and I'm sure a lot of people are listening. Please write in and tell us what answer was the best. Oh,
well, they're almost exactly the same.
Okay, I know.
So my answer was a couple of reasons you see this square appearance. One, having a tummy tuck without liposuction of the flanks. Two,
real quick, so liposuction of the flanks means of your upper hips, right? So a lot of times with tummy tucks, people will pull the skin down and tighten the front, but they don't take care of the side business, right?
Or like around the back.
Around the back.
Yeah.
And like you got to go circumferentially. A tummy tuck is not 180 degrees. It's 360 degrees, no matter what any surgeon tells you. Okay.
So, two, the natural shape of the body is less curvy. And that's very true. I mean, some women are just not as naturally curvy as others. So liposuction of the flank helps define the waist and is almost always included in our tummy tucks. It is a rare woman who would not benefit from at least a little contouring of the flanks.
Right, almost no one.
It's very rare.
Yeah.
I mean,
even in Colorado, super skinny place.
And even for someone who kind of has no shape, carving out that low back kind of gives you the appearance of a shape.
Yeah, liposculpting with a tummy tuck is mandatory. We don't. If someone comes in and says to us, like with a tummy tuck, they don't want liposuction on the sides, we pretty much say no, we're not going to do the surgery because it's going to be a partial result. Go ahead. Yeah. All right, so this is mine. I'm ready for mine.
Okay, so this is Dr. Martin's answer.
I know this one's going to be good. So much better than this.
There are two common reasons.
Okay.
Again, two common reasons. One, with rectus diastasis repair, which is tightening of the muscles in the midline, the waist contour can take on a more squared appearance.
It pushes out. So when you tighten the middle, the pressure has to go somewhere, and there's fat and guts and all on the inside. It pushes out to the side. So where you normally have this concave shape going into your hip bones, it can push out a little bit.
Yeah. And number two, most common, liposuction along the waist is not included or added to the procedure. Therefore, the residual fat is left behind that blunts the contour. FYI, liposuction is standard in our office with tummy tucks.
Standard.
So, I mean, we pretty much answered that almost exactly.
I know. We're like an old married couple that answers each other's jokes.
Right.
All right.
Yeah. Okay. So that was the funny one. So now I have one, another nutrition one. So
okay.
That's both of us. Yep. All right. So this is a good one. So this question is for Amy. I lost 75 pounds this last year and a year and a half using weightlifting, cardio, and bodybuilder style meal prep.
Never went to stop there. So this is also anonymous?
Yes.
All right. Thank you. Thank you for losing 75 pounds using weightlifting. I just want to throw that out there.
All right.
Yeah. Right? So every woman we see, I don't want to do weightlifting. I don't want to get bigger. I don't want to bulk up. Like, give me a break.
Yeah, because bulking up is so easy.
It's so easy to do.
So using bodybuilder style meal prep, 5 to 6 small meals a day, about 1,450 calories. However, now I would like to transition to an even healthier diet and lifestyle that I can sustain long term. Which path would you send me down?
Oh, I can answer this question, but you please go ahead.
Well, let's let you answer it first. You're not a nutritionist.
No, because I'm going to make myself sound stupid.
No, go ahead.
I will say that a couple things. I'm not going to answer that question. I'll make some generalities that I hear you say to patients and me and to my family and stuff. First, A sensible diet is full of foods that you like to eat, you enjoy to eat. So eating should be fun and enjoyable and provide you with nutrients that you need. That's the first thing. So on a baseline level, don't look at food. You should look at food as something to honor and enjoy first. So you start there, get your head right. The second thing is that Amy's my sister. I got COVID brain.
Rhymes with Amy.
Yeah, exactly. So the second thing is you want to look at the way you look at it is you look at what do you call it? Ancestral nutrition. Ancestral nutrition. If it was something that could be grown on an island where you live, and it would have the things that were grown there are raised, okay, animals too, and that's what comprise your diet. That's where you should focus, like whole food diet, so ancestral nutrition. So that's the second thing. You want to really get yourself in a food selection area that's good. Now the third thing is for me personally, and I'm going to wait and hear what you say. So this is me. This is not Amy.
Well, this is not a woman who's lost nearly 100 pounds.
Yeah, exactly, right? For me personally, I like to eat for a goal. Okay, that helps me personally. I am weightlifting. I want to put muscle on. I want to be a certain body shape. That is important to me. That helps me personally, just so you know. But I want to hear your answer.
Right, so she's specifically looking for advice for what to do next. And my biggest piece of advice would be that 1,400 calories a day is not enough nutrient, not enough calories.
That's what stood out to me.
Getting the nutrients that you need. So the first step I would take, especially if you've been on that low of a calorie diet for this long, is to slow the reverse out of that. So getting to a place where you're eating it's going to be pretty impossible to eat a truly healthy diet on that few calories for an extended period of time. So it's scary to do, but it's very necessary and you can do it very slowly. Feeding your body and nourishing your body means that you're eating enough to get the nutrients that you need without having to get them all from supplements.
Because if you have 1,400 calories, you're robbing yourself of macros somewhere. So something's going to give there: carbs, fats, or protein, right?
All of them. If you're eating 1,400 calories a day, you're not eating enough of any of them.
But you could eat all protein and no fats and carbs.
But that's when you're not getting enough of anything.
Yeah. Okay.
You're literally at that calorie intake for a grown woman who is doing muscle building activities. You're really going to start spinning your wheels really quickly. It's fine. Obviously there are periods of time where you're trying to cut weight and your calories are definitely going to get low. But even for competitive bodybuilders who do like competitive bikini competitions, it's rare that any of these competitors would get that low in calories for an extended period of time, maybe a few weeks. And there are some very, very petite bikini competitors who are in the less than 100-pound range that probably get down to 900 to 1,000 calories a day during the very final stages of their bikini competition. But that is immediately reversed. Those women in the off season are probably eating closer to 1,800 to 2,000 calories, and that's for a less than 100-pound woman. So for most women in the 130 to 160 pound range, a healthy intake of calories for maintenance should be closer to 2,000 calories a day. And obviously there's variations for all women amongst that, but really, really, I would highly recommend finding a coach to work with to help you do a diet reverse. And it doesn't mean you're going to gain weight. In fact, it probably only means you're going to gain muscle and maybe even recomposition for your body to put on more muscle.
Might look better.
You're going to probably look a lot better.
Yeah.
Also, your body will be under a lot less stress, and it'll be a lot easier to eat a nutritious diet. So I would start there because, as I said, it's going to be very challenging to eat a truly healthful diet on that kind of calorie intake.
Right.
Very hard.
What above and beyond the calorie intake? She wants to have something that's long term.
Yeah, so you got to reverse.
Okay, but after that?
So after you reverse and you're eating a normal calorie intake, focusing on a whole food ancestral diet is what I recommend.
Oh, okay.
Yeah.
So I was right a little bit.
You were, but you can't. You can't get there without the other.
Yeah,
unfortunately.
I agree. Yeah. There's actually a good episode. Paul Revelia. We did this a couple of years ago. He was a coach, and he really goes into the dietary stuff, and it can be really problematic when you restrict yourself of calories. Your body, and there's so much data out there. You can look on. Even on social media, people talk about it all the time. When you restrict your body for so long, it really does not put it into an anabolic state. It's
very stressful.
It's very stressful. A lot of cortisol.
Well, and you're just robbing yourself of nutrients. You're not able to eat a very nutrient dense diet at that calorie intake. You just can't.
Right.
For a person now, if you are sedentary, like you literally don't get off the couch ever, like ever. 1,400 calories may be enough to keep you alive, and you'll die of sarcopenia. It'll be a real sad, slow
muscle
death.
loss. Yeah.
Yeah.
And it depends what your BMR is. Yeah, I get you. Okay.
Yeah, and
Okay.
So that's where I would start. There are and I will send this person a DM with some resources that I would recommend. There's some amazing coaches that work specifically with helping women regain their health.
We got you, Anonymous.
Yeah, so that work with hormones, and that's something that really struggles when for women and men who are eating an extremely calorie restricted diet. You see that with competitors, you see that with people who chronically diet. You struggle with infertility, hair loss. Lack of sex drive.
So you have low calories, your hormone production is down or not appropriate, and then you're suppressing your fats, which are needed for hormone production. It becomes a real big problem. You become dysfunctional, and there's so many cases like that. So
and sometimes those effects aren't immediately seen.
Yeah, reversing is the way. Yeah.
You might not realize that you're not feeling that great because you're used to it. Like our bodies are pretty amazing in their ability to push through times of extreme stress, but eventually those things will start to catch up with you, and whether that's hair loss,
as is evidenced by the last month.
Yeah, but I mean, it really does. So even if you're feeling great, you're like, oh, Amy's crazy, she wants me to eat more, she's insane, I hate her, she's wrong.
I've said that before.
Yeah, it's definitely that's where I start, and you really have nothing to lose. So if you eat an extra 200 calories a day of like nutrient dense food, it's very unlikely you're actually going to gain any amount of weight. In fact, you might lose weight and put on some, increase your lean muscle mass, which will help you age better. It's going to help with your hormone production. It's going to help you live a longer, healthier life. So
right.
Very important. And women, it's very hard. I mean, there's a lot of social pressure on women to look a certain way, to be a certain way. When you've worked so hard for something, I get the fear of like losing that. And that's why I said there's some great coaches who can help you, work through that process and do it slowly and safely and not gain any weight.
I will say I lost weight and then decided to put muscle on, and it took me a while for my brain to react to be good with the scale going up, which was representative of me putting muscle on, right? You have to switch your brain around a little bit.
Well, you don't have to gain weight in reverse.
No, I'm saying that, right, that's a good point. My point is even a little bit of weight gain is sometimes very good in certain situations.
Yeah, changing your muscle density is very good. And getting away from just being obsessed with the scale and counting macros, I think, is a really positive step for like long-term mental health also.
Yeah, okay.
Yeah. So that's it. Those were our questions.
That's pretty good.
I know. I was hoping we could end with a gross one, but I couldn't. Sorry.
That's okay.
Not all that great on Instagram.
I like the fact that we answered that question pretty much the same, but I threw in rectus diastasis, so I give myself a vote.
Well, and I threw in the fact that not every woman is curvy.
That's good. Combine both of our answers would have been the perfect answer. All right, well, that was fun. That was definitely good. I think the next we're gonna get away from pirate podcasting next episode.
Hopefully, no guarantees.
Yeah, no guarantees. So this is probably the last of the fun with no teacher here. Like Nils is not here to tell us what to do, so we're kind of just hanging out. We hope everyone's safe. We're thinking of everybody. And hopefully people are listening to our podcast and getting some enjoyment out of that, because that's what we need right now.
Yeah. And definitely be sure to follow us on social media. So if you are listening to this and you'd like to see the not very interesting video that went along with it, you can find that on YouTube.
Of which we produced.
At Jason Martin MD, and also on Instagram at Jason Martin MD and at Beauty and the Surgeon Podcast. So we will keep doing these. We do get a lot of questions, and it's fun to answer questions. We also do sometimes shout out our 5-star reviews. So definitely leave us a like, comment, rating, and review us, and share us with your friends. We do appreciate you all so much for watching, and we'll see you next time.
All right. Be safe.